Hey guys, welcome back to Medical Coding with Blue. Okay, today's episode is going to be all about what to expect when you're applying for your first medical coding job. Okay, I have applied 4 times and been hired 4 times with medical coding. Different positions, different jobs. So this is what happens. Pretty much it's a standard practice for most places. However, sometimes things were a little different. So these are some of the things you can expect when you start applying, okay? So first, when you do apply, make sure your resume looks really good. Make sure there are no misspelled words in your resume. That's just my little tips on that one. And make sure you do not abbreviate anything, okay? This is a little thing, but it can be a big thing. Sometimes not everybody means the same thing when they're abbreviating something. So your abbreviation for something may be different from another person's. Just a little tip from me to you. And again, I've stressed this in other videos. Always make sure that you're using proofreading software whenever you are doing your resume, because if there are any misspelled words in there, it's going to be picked up really quick. Because the idea is if you can't get words spelled correctly, you're probably going to miss details when you're coding a medical record. I'm just saying, it may seem a little harsh, but it's true. And I want to set you guys up for success. Also, when you are applying, make sure that your resume reflects what they're looking for as well, if you possess those skills. I'm not telling you guys to lie. I'm just saying, if you possess any of those skills that are in the job listing, make sure it's in your resume. Because they're not mind readers, they don't know. Okay, so you've submitted your resume and you get the call. They're going to send you a practice test, or they're going to send you a test to see what you know. This test can be one of two things. It can be either really easy, or easy as in like very few questions, very few scenarios, that kind of thing. Or it could be very comprehensive, where they're going to send you like 10 case scenarios, and depending on if you're applying for inpatient or outpatient, they're going to send you those scenarios for those settings. Or if you're applying for an ER coder, same idea. So they're going to give you some scenarios. The amount of scenarios can vary from place to place. I've had one place give me 20 scenarios, which they gave me a couple of days to do the test. I've had some places where I applied, it was 10 scenarios, but it was 50 questions of just randomness of how would I handle a particular situation? How would I, with like coworkers and things like that? How would I handle ethical issues? And they give me like scenarios for ethical things that can happen as well. And then sometimes it's just plain old testing of your knowledge, your basic knowledge of ICD-10 and CPT. Or at the time, it was ICD-9. But they're giving you those base questions so they know what your detail is, how closely you pay attention to detail, and what other things that you know, how deep do you know. Which is why I always encourage, if you haven't gotten a job yet and you're still out looking for a job, this is your first time out looking for a job, get ready, okay? Because it's going to happen. You'll eventually get to a place where somebody will say, we're going to give you a test, and then we'll call you. When they give you this test, it is very important that you do very good on this test, because sometimes this test is going to be the difference between getting a call back and not getting a call at all. I'm just saying. So you want to make sure that you are still practicing. Please still practice. Even though you've been looking and maybe it's been a while, it's been a few months, continue to practice with the book. Make sure, even if you have the year before book, it doesn't matter. Still continue to practice, because as you continue to practice, you will get better. You will get faster. It will make more sense to you. But you can't just stop and then just waiting to get a job and that be that. You can't do that. You have to continue to stay on it, okay? It's very important. I have, not to sidetrack, but to give myself a little plug on my own show. I have Q&A Tuesday, and not Q&A Tuesday, Quiz Friday. I have Quiz Friday which I post in the community tab, and we talk about answers on Answer Monday. Obviously, I didn't do it because, like a bonehead, I left my notes at the office. I was like, ooh, and I looked everywhere. I was like, Friday, I was like, oh, okay, yeah, sure, I'll look for them. And I'm looking and looking and looking. I'm like, maybe I'm just tired. Let me just rest and I'll post it in the morning. And I'm looking, and Saturday, and I woke up and I thought, oh, I know what I did with them. I just left them. I was checking on an answer on one of them, and that's what I did. So sorry, guys, but don't worry, it'll be back this coming Friday. So just enjoy. I hope you've all enjoyed your weekend. But use my my quiz Fridays as practice. They are not official. Okay, these are not official. But this is just me as a veteran medical coder sharing the things that I know. I have a lot of knowledge. The reason that I do this channel is to share that knowledge. A lot of times, us as medical coders, we're learning things independently and on our own. And a lot of times when we're asking questions, sometimes people don't know. And so it's always a good thing to network with other people. And this is sort of a way of networking, you know, if you're here. And I hope you share my videos if they do help you, because maybe they'll help somebody else. You never know. Anyway, back to going into our topic. So, continue to practice. That is very important, because when the practices that I do, or the questions that I give you guys, are more detailed, I think, because this is the stuff that you see in the real world. I've talked about how book coding and real world coding are two different things. I did a video on it, and I will probably link it up here. It is different when you're coding straight from the book and you're having book scenarios. These are things that are, all the information is there. These are perfect in every way. But when you get out into the real world, you're going to have different people, different personalities, different documentation to look at. And again, every electronic medical record is different. So maybe the structures of the note is not always going to be the same. So just another thing to keep in mind. I know it's a lot. You're thinking, what the heck? Just accept everything. Just accept that it's going to be a lot, and it's going to be fine. Trust me, you will be okay. We were all there at one time. And as long as you're patient with yourself, that is the most important thing. Okay. Now, so the other thing is, when you pass your pre-employment exam, this test, right? And again, these questions can cover everything. You will be allowed to use your books, because these are generally open book questions. If they call you, now if you pass this test and they decide to call you and give you an interview, be prepared, because they will run a background check on you, criminal background check. They have to. These positions are highly sensitive with the information that we have access to. This is people's private medical information. I mean, think about it. Everybody, your whole life on a sheet of paper. You know, if you're coding for psych, you're looking at people's personal situations. If you're looking at anything, any record, you're looking at people's personal situations and things that are sensitive, that doesn't need to be talked about with anybody. You're being trusted with this information, okay? So you will have to have a criminal background check. They will be looking for felonies and things like that. If you have had any issues in the past with HIPAA, obviously they're going to be looking for that as well. If you've had a felony in the past, you know that this is not going to immediately count you out for positions, but you will have to explain yourself. So be honest. If you do have a past, make sure that you write down all the detail, and you're very upfront and honest, and you let them know when it was adjudicated. You've got to let them know all of that information, because they're going to find out anyway. So there's no sense in trying to keep it and hide it, okay? Because you will be found out, you know, because this is very, very serious stuff. You will be given a drug test. I've been drug tested 3 times. And it's just a standard operating procedure of getting hired. That's all it is. So just letting you guys know that it's not personal if they ask you, hey, you got to pee in a cup. it is not personal. It happens to everybody. And I've actually, when I was interviewing one time, the lady who became my supervisor, she said, "Oh, you know, Blue, we're really excited to have you, and we're just so glad that you've applied and everything. But I have to ask you a question." I'm like, "Oh, yeah, what? You know, what?" And she's like, "Can you pass a drug screen?" I'm like, "Yes, I can pass a drug screen." I was like, "Why would you ask that?" And she's like, "Believe it or not, there's a lot of people that cannot pass a drug screen." She said, and I have interviewed 4 people, and I have not, all of them could not pass a drug screen. And I'm thinking, if you're applying for a job where you're working in a medical facility, or even if you're working at home or whatever, you have to be of sound mind when you are doing medical coding. You cannot have this, you know, illegal drugs, you know what I mean? You can't be doing that. That is just, there's just no, you can't do it, okay? So I'm just letting you guys know that that is what happens. Then once you get past all that, so you've gotten past the test, you've gotten past a background check, and you've gotten past a drug screen. Now you got to physically go in for an interview. Now, this interview can be one-on-one with somebody. I have always had it be a panel. So get ready, because you are probably going to be in front of a panel. And what I mean when I say a panel is it's going to be usually the supervisor, maybe somebody from data quality, and then a person from HR, and then maybe another person who's in the department, and then maybe a lead, okay, or maybe a coding coach, or whatever they call them, okay? Every place calls them different. But you're usually in front of a panel, and they're going to ask you questions, and sometimes they will say, you know, okay, well, the last one that I had, I was in front of a panel. There was 3, and I had to do the test right in front of them. So I had done a pre-test, and I had turned it in, and of course they were all okay. They go, "You passed it." They go, "Well, we're going to give you some questions, and we're going to see if you can think on your feet." And I'm like, "Oh, sure, no problem." So they were like, "Okay, what is this? What is this? What is this? What is this?" And they were just giving me random diagnoses that I had to look up. So I was like, you know, and I'm just looking them up as quick as I can. And I'm giving it to them, and they're like, okay, you're doing good, you're doing good. And I'm like, oh, okay. Then they asked me what the breakdown of some words were, like otomy, what does that mean? What does oma mean? So the prefixes and suffixes, they were looking for that as well, because you have to know that. Medical terminology is very vast. So the best way to learn words is to learn the prefix and suffix. What do they mean? And if you can figure out the prefixes and suffixes, then there's a good chance you're going to be able to find out what the rest of the word means by just using the clues, okay? That's one way to pick up a lot of medical terminology. At least that's what I did, and I've been pretty good at it. And it's really easy to pick it up after a while. Once you start to learn the breakdown of the words, you can put it all together. So that was what happened with me. And then once you finish the interview, they're going to know that, of course, if you're nervous, you know, they are going to be able to sense that. Have a good attitude about it. Have a sense of humor about it. But be serious and be sincere when you are in an interview, okay? And especially, I've talked about this before on interview tips, which is another video I probably should link. If I can remember, let me see if I can remember. So on these interviews, you want to make sure that you're going in very well dressed. And if you search my videos as well too, you can see where I've given interview tips, like how to go in and be as professional as you possibly can. But this is very, very important. When you're going in for this interview, and this is maybe your first job and you're trying so hard to get the job, look the part. Whatever you do, look the part, because they need to know that you're serious. And sometimes you may have to have contact with providers. They need to know, who are they going to put in front of this provider? They need to put the best representation of a medical coder in front of providers. This is what I strive for every single day when I go to work, is to be a good example of what a good medical coder is in front of providers. You know, I've talked about it on other videos as well, that when you are working in teams, or maybe you're working in a facility and they say, oh, well, this so-and-so coder said this and this so-and-so coder said that, it's important to show a united front. If you don't agree with what the other coder said, be sensitive on expressing any opinion about anybody else. It's best to not do it and stick to the facts and show them how you're able to come up with your answer, okay? Never bash another coder in front of providers. That is rule number one. I've had that happen to me several times where people bash me, and it's fine. You can bash me all you want, but I'm not going to do that to you in front of other providers. That's where, you know, you don't air your dirty laundry. And I've said this. So just a little tip for when you get in. Always be a good team player. That is really, really important. And when they ask you what your qualities are, think about what your good qualities are. They don't want to know the run of the mill, okay? They've heard the run of the mill 100 times. They need to know what makes you unique. What talents and strengths are you bringing to the table? How is you being there going to benefit that facility, that hospital, that doctor's office? How is that going to benefit them? Okay. Now, I know you all have heard you got to learn to sell yourself. It's true. Sometimes we have a hard time talking really good about ourselves and displaying our strengths because we think maybe it sounds conceited. I even struggle with this too. And sometimes when I say, well, you know, I try to do this and I try to do that, I always think, do I sound conceited? But I know for me, it's coming from a place where I'm being sincere. And I'm being sincere. And when I share my experiences with all of you, when I share how to talk to providers and things like that, it's just so that maybe what I say can reach somebody and help somebody else. So hopefully this video helps. And if this video has helped you, I hope you share it. It really does mean a lot to me when you guys view my videos and when you take the time to ask questions and very detailed questions, because you all know how I feel about those detailed questions. It's just really very important to me, and I want to thank you guys for being part of this journey with me. So, but yeah, that's pretty much what happens when you are applying and what you can expect. When you start working, there's really not a whole lot of preparation you can do other than to study the book and read your guidelines and make sure you know them forward and backwards. Because every facility is different. There's going to be different rules. And so it's sort of hard to prepare yourself. But I hope this is helping you to kind of get a snapshot of what to expect right before you go in. But I will have to do another video because I did do a video before about what to expect when you are a new coder. I'll probably have to do another one again. Because I did that one a while back, so hopefully I will do that one, and I will share more on that topic. So, all right, I got a couple good questions for Q&A Tuesday that's up tomorrow. I will be posting those. I'm not doing Motivation Monday today because it's late, and I sort of hit a stump on my Motivation Monday. It's a process. It's creatively, it is a process when I do these, and I hit a wall on that one. So I want to bring you guys good content, and I want it to be something that's worth your while. Okay, so but anyway, Motivation Monday will be back next week though, so don't worry. If you have any questions for Q&A Tuesday, it's not too late to submit them. Just let me know, and I will be filming later for Q&A Tuesday. So If you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all on the next video. Bye!